I am a physical therapist or physiotherapist, and I'm going to describe to you a little bit about what classification is and show you how we do parts of it. Classification is a way to evaluate an athlete to see what muscle function they have and how they are able to use that in the play of the actual sport of wheelchair rugby. Classification has two roles. One is to determine if an athlete is eligible to play the sport of wheelchair rugby, and also to help us group the athletes so that they compete against others who have similar functions. Wheelchair rugby is a game that's designed for athletes with tetraplegia or impairments like tetraplegia. So there are athletes who have disabilities that are not eligible to play this particular sport. The people who do classification are persons with some medical training in evaluation of neuromuscular conditions. So they are physicians, physical therapists, physiotherapists, occupational therapists, are sports medicine people with a background in neuromuscular evaluation, like adapted physical education in some countries. When an athlete is classified, they are classified internationally by a panel of 3 classifiers. So it's a decision that's made by a group and not by one individual. If an athlete needs a temporary or provisional class to find out where they should be in play, a person may do that in your own country to give you an idea of where you might play. Once you go to an international tournament and you're seen by a panel, there's a possibility that that could change. In wheelchair rugby, we have athletes who play who've had spinal cord injury, where their cervical spine or their neck is involved, so they have involvement in their arms and their legs. We have athletes who play who had polio. We also have athletes with muscular dystrophy, multiple sclerosis, multiple amputations, limb dysmelias from birth. In classification, there are 3 parts that the athlete goes through. The first part, the athlete has an interview where we get history information from them, and then we do a manual muscle test of their arms, and we call that the bench test or the physical assessment. After that part, the athlete's asked to do some activities and tasks that you would do in wheelchair rugby for the classifiers to see how they do those activities. The third part of classification is observation in competition. So the classifiers will watch the athlete during play to see if what they do on play is consistent with what we would expect someone in that class to be able to do. Once an athlete goes through the physical assessment, they're given a class that allows them to enter into competition where we can watch them. Competition is used to confirm that class, but it is possible after observation and play that the athlete's class may change. When an athlete presents for classification at a tournament, they're usually seen by a panel of 3 classifiers, and they come to the room in their actual plane chair with all of the strapping and equipment that they use. They won't be wearing gloves or tape so that we can see their hands, but they will be asked to put that on later during classification. If an athlete is receiving a temporary or provisional class from one person to get an idea of where they might play, they can be seen in their everyday chair, especially if that's what they're playing in, and they may not be using any equipment at all. So that's what we'll demonstrate now, if this would be an athlete's provisional class. So what's your name?
My name is John.
John? Okay, and what's your family name?
Bishop.
Okay, and do you know your diagnosis?
Yes, I'm a C6-7 tetraplegia.
Have you been classed for rugby before?
Never.
Never. All right. Have you played any other sports?
No.
Okay. And where do you play? What's your country?
United States.
Okay. And what's your team?
South Florida Rattlers.
Okay. How long have you played rugby?
I haven't.
Okay. Brand new. Great.
I just discovered it.
Okay. And what is your date of birth?
3/18/67.
So March 18th,
Yes.
1967?
Yes.
Okay. And when did your accident occur?
In 1987.
Okay. Great. And are you right-handed or are you left-handed?
I'm right-handed.
You're right-handed, okay. And is this the chair that you will play in?
For right now, yes.
Okay. And so you're playing now in an everyday chair?
Yes.
You don't have a sport chair?
Not yet.
Okay. And do you use any kind of belts or straps on your body?
Yes, I use a strap around my waist.
Okay. So
And-
is it down on your hips or is it up around
No,
your
it's more
belly?
on my stomach area.
Okay. Belly binder. Good.
Yep. And I use a strap for my feet
Okay.
to keep my feet
Down
on the
around your
footplate.
feet. Okay.
Down on in the front of the chair here
Okay.
to keep them from coming out.
Good.
And I also wear gloves.
Okay. Good. Do you have any place where your spine has a curve or it sticks out?
Not that I'm aware of.
Okay. Do you have any place where you aren't able to straighten out your joints, where you have contracture or stiffness?
My left hand,
Okay.
I'm not able to extend my fingers.
Okay, so your fingers are curled like
Yes.
that and they don't come out straight.
That's correct.
Okay. Okay. Does that help you do anything? Do you have, is that something you've worked to
It
keep?
helps me with lifting
Okay.
something that has a handle
Okay.
or carrying. I can hold a glass or a bottle or
Okay.
utensils.
Great. Have you had any operations that from your injury?
I had surgery to help me get grip in my left
Okay.
hand, and that's the reason that my fingers are contracted.
Okay.
They tightened it up.
Did they take a muscle from somewhere to move it there?
No, what they did was they shortened the tendons
Okay.
so that when I lift my wrist, I have a stronger grip.
Great. Do you have any spasticity or spasms?
In my legs and
Okay.
my waist,
Do you take any medicine for that?
yes, I take baclofen twice a day.
Does it affect your balance in your chair?
I don't think the medicine.
Your spasticity?
Yeah, sometimes it will. If I haven't taken the medication, I'll get thrown back in my chair, or my legs will push me up in the chair.
Okay, good. Are you able to stand up?
No,
Can you walk?
no.
And where do you have feeling in your body?
I have normal sensation in my arms. The back sides here
Okay.
are a little on the numb side. And
Okay.
I have normal sensation down to the middle of my chest and on my back. And the rest of my body is touchy as to where I do and don't have
Okay.
sensation.
Okay. All right. Now, the reason that we ask an athlete questions like this is it helps us decide, it helps us as we observe the athlete know if some of the function we see is because the muscles work, or in the case of this athlete, he's had a surgery that lets him shorten his fingers. So it may appear like when he's on court, he's actually grabbing or gripping something when he doesn't have the muscle power to do it. And it's all a position where he can tighten the muscles passively. In rugby, as part of classification, want to classify what muscle function the athlete has. If the athlete has some surgeries or some equipment or some training or skill that allows him to perform things at a higher level than we might expect, we don't want to penalize an athlete for doing those things. Also, if we see an athlete, when we observe an athlete play and we realize they've got certain muscles that work, but we don't see the athlete using those on court, because they're not very trained, they haven't practiced, they don't know the game well, we will not lower their classification because of that. So when we classify, it's based on the function the athlete has, and how well they use that helps us understand what we may or may not see on the court. John, I'm going to go through now and I'm going to do some tests on you like your doctor or your physio did when you were in the hospital.
Okay.
And I'm going to test the muscle strength of your arms and have you put your arms in certain places, and then I'm going to push on you.
Okay.
Do you have any pain in your shoulders?
No.
Okay. And do you have any pain anywhere in your arms?
No.
Okay. The reason that I ask an athlete if they have pain is pain can affect our muscle grades, and if an athlete has a level of pain that prohibits us or prevents us from getting an accurate picture of their muscle strength, then we cannot classify them at that time. We won't get an accurate picture. So that's a reason to ask if an athlete has pain. Also, pain may affect which position you use with the athlete, and I'll demonstrate those in just a minute. Okay. So I'm going to go through and test your shoulders and your elbows and your wrists and your hands.
Okay.
Okay? And I will be carrying this around and writing down some grades. We do a manual muscle testing that is explained in the classification manual. We use grades of 0 to 5, with 0 being no muscle function, 5 being normal muscle function. So as I go through testing, I will call out what those grades are as I do those.